Hello, I am Dr. Rajat Gupta, board certified plastic surgeon working in Delhi. What we'll be talking to you today about is chin augmentation procedures. A lot of people, especially in Indian subcontinent, have retruded chin or a small chin. Now, what does retruded chin or small chin means? Retruded chin means that their chin is much more behind than their lower lip if you see them in a profile view. And a small chin means that the chin smaller in height. So we plastic surgeons use rule of three. What does this mean? That the distance between your hairline to the root of the nose is equal from the root of the nose till the upper lip, and this is equal to the base of the nose to the chin. These three segments should be equal to make someone look aesthetic or nice, and their face is in proportion. But many men and women have the chin small, and their lower one-third segment is actually smaller than the middle or the upper third. Then they may need a chin elongation procedure. And the other issue which some people may have, that the chin is retruded. That is, if you see them in profile view, their chin is set back. And what they need is a chin elongation in a horizontal axis. So these are the two issues which are very commonly treated in our aesthetic practice. Chin augmentation. How is this done? There are essentially two options in how the chin can be augmented. One, it can be improved by using fillers, which are hyaluronic acid. The procedure takes 10 to 15 minutes, and we put fillers through injections. They come in a syringe, and we put them with a needle prick at different areas of chin to give you a nice, shapely chin and give you a great aesthetic result with hardly any downtime. The only issue with fillers are they are temporary. The result lasts 10 to 15 months depending upon individual body tendency, individual fillers used, and so on. If someone wants a much more longer lasting or a permanent result, then the options are silicone implants. I know a lot of people of you might have heard silicone implants with respect to breasts. Those are silicone gel implants. What we are talking to you about is silicone solid implants used for chin augmentation. So, how this procedure is done? This procedure can be done under local anesthesia as a daycare surgery. A patient walks back home with a new chin same day, evening after the surgery. We give an incision inside the oral cavity, just in front of their teeth, so that there is no scar visible on the face or in the neck. We go inside and make a pocket over the bone. Now, this pocket which is made is absolutely precise so that this implant sits on the bone where we want it to be. And hence, the surgery should only be done by doctors or plastic surgeons who are experts in doing these surgeries and have experience. Now, after we make a pocket over the bone, we place an implant. Your surgeon may choose to fix an implant along with this so that that implant doesn't move and stays into the place which we have placed. I usually fix it with some sutures. I use 2 to 3 sutures to put the implant into a decent place which we want it to stay, and then close the oral cavity incision by absorbable sutures. So these sutures which are used are absorbable and need not be removed. One can have semi-solid or liquid diet from same day onwards and can resume normal solid food diet after 72 hours. We just prescribe them basic antibiotics and analgesics for first 5 days. So it's a very comfortable surgery which can give you a very gratifying result. Let me show you a couple of examples of how the surgery is done and what impact the surgery can make to your facial profile. Now, if you can see this individual, if you see only the left side of the face, what do you think this boy does? 90% of my patients tell me that this boy looks like a college goer. Now, if you see him, his chin is set back. It is quite back from his lower lip. You can see the gap. What we did was chin augmentation to change his profile view completely. Now, you can see the difference. If you now just see the right side of the face, and if I ask you, what do you think this boy does? Most of the patient respond saying he looks like a model. So yes, chin augmentation is used very commonly by many celebs, models to make their face aesthetic if they have a retruded chin. Let me show you this patient's other side view. You can also see his other side profile view, and you can see even in this, a retruded chin has been brought out, and what an impact it makes to his whole face. This guy looks much more handsome as well as fit. Now, this is an impact what a chin augmentation can make. Now, chin implants are also of different sizes and shapes. So we decide the size depending upon what an individual needs are. Your plastic surgeon will do some measurements on your chin and calculate the lip and chin proportions to decide how much augmentation you need, and then decide about an appropriate size for you. At the same time, chin implants comes in various shapes. In fact, you can also get a chin implant which is customized to the shape which you exactly want. I'll be showing you two shapes which are commonly used and what impact it makes into different individuals. If you see, these are the two shapes of chin implant I have in my hand. This is called as an anatomical implant, and this is called as a U-shape implant. What is the difference? If you see, this is quite a big implant which has to fit in the complete jaw. This is used when you want a face to be made a much more broader chin. Many males especially want a broad masculine chin, and this is used in those cases. This is a much more conical implant and used to make a V-shaped chin which is much more sharper and pointed. So these are the different shapes of implant which are commonly used in cosmetic surgery. Of course, the implants are customized and cut according to fit individual bones so that they fit very snugly and look very nice. Now, one has to understand that this surgery is a very precise surgery. One should always get this done by a board certified plastic surgeon who has experience in doing these surgeries. So choose your surgeon appropriately, meet your surgeons, see their result, understand what kind of implant they want to use, what size, what shape of implant they plan to use for them, for your case, and then decide to go with the surgery. Because remember, this is a permanent procedure. Of course, you can get an implant out if you don't like the result. I would not like to undo a procedure if I really want it. So get the procedure done well to get an improved version of your own self. I have tried to answer most of the questions asked by my patients regarding chin augmentation. If you have any more questions or doubt, feel free to write into us and I'll be there to help you. Thank you.